Բարև ձեզ սիրելի հայրենակիցներ, այսօր նորից մենք գտնվում ենք HOSPICE Grace-ի տաղավարում։ Այսօր մենք ունենք շատ կարևոր մի հյուր, բայց մինչև մեր հյուրին ներկայացնելը ես կուզեի, որ դուք զանգահարեիք ձեր բոլոր բարեկամներին, զանգահարեիք ձեր երեխաներին, այն մարդկանց, ովքեր որ հետաքրքրված են Medicare-ի հետ կապված փոփոխությունների հետ, եւ ներողություն պետք է խնդրեմ դեզանից, որովհետեւ այս շոուն մենք պետք է վարենք անգլերենով, որովհետեւ մեր հյուրը անգլախոս է, հայ չէ, բայց information-ը, որ պետք է տանք ձեզ, շատ կարևոր information-ը եւ շատ կուզեինք, որ բոլորը տեղեկացվեին այդ information-ը, որը պետք է փոխանցեր այսօր մեր սիրելի հյուրը։ Այսօր ես ներկայացնում եմ, ինչպես որ նշեց, շատ կարևոր մի հյուրի, որի անունն է Rasmus, եւ Ken-ը այսօր որպես consultant, որպես խորհրդատու նա աշխատում է Ward and Brown ընկերության հետ։ Նա մասնագիտացված insurance agent է եւ իր լայսենսը ստացել է 1992 թվականին։ Եվ նա Ken-ը այսօր մասնագիտացված է Medicare-ի հետ։ Նրան մենք կարող ենք այսօր կոչել որպես expert, որպես հատուկ մասնագետ, որը հասկանում է Medicare-ի մասին եւ Medicare-ի health plan-ների, այսինքն այդ insurance company-ները, որոնք աշխատում են Medicare-ի հետ, եւ նա օգնում է նաեւ մեր նման մարդկանց, ովքեր որ աշխատում են industry-ի մեջ եւ medical group-ների մեջ եւ leader-ների հետ եւ նրանց օգնում է, որ նրանք օգնեն այդ մարդկանց, ովքեր որ պետք է ընտրեն Medicare-ի տարբեր պլանները եւ ընտրեն այդ պլանը, որը որ ճիշտ կլինի իրենց համար։ Welcome, Ken.
Thank you, ARPI.
Thank you so much for coming to our show. It's an honor to have you. I just explained to my viewers, I just talked about a little bit about your background and where you come from, and I want to call you as an expert in Medicare.
I appreciate that. Thank you.
Yes, as we know, the change is coming. Everyone's confused today. There is so much information out there that either it's valid or not valid. But all of the guests that we have on Hospice of Grace show, they're experts like you, and we always give good information and information that's coming from a valid source. In my past shows, we talked about Medicare and we talked about the changes, but still, I myself being in managed care for so long, and I work very directly with Maverick Medical Group as one of the medical groups in the community. I myself am still a little bit confused about this change. That's the reason we have you, so you can give us, the information and we can have a better understanding of the changes. Can we talk about just Medicare today? What's Medicare and what is coming up with the changes and with the programs and the healthcare?
Sure. When I think about kind of where we find ourselves today, I think it's appropriate for us to take a look back in time just a little bit and realize that when Medicare was enacted in 1965, there really hadn't been any changes for the most part to that system until 2003, until the Medicare Modernization Act was signed into law. And really the only change that came from that was the addition of prescription drug benefits to the Medicare program. So when you think about the system itself and the way healthcare was really being delivered, really there had been no changes since 1965 to that system.
Okay, and today we have the Medicare and we have the dual affiliations, and we know that people, because I'm getting a lot of phone calls, people are getting the letters, their blue envelopes from Medical Connect, and they have to choose a medical group, they have to choose a health plan, or there is an option they can opt out. Can we talk a little bit about that?
We can. When I take a look at CalMedi Connect in general, that's probably the most sweeping change to affect the Medicare and Medi-Cal population since the enactment again of Medicare. I know in 1977 when the Healthcare Finance Administration was enacted, it was really the first opportunity for a regulatory organization to be put in place to kind of monitor and take a look at that activity. And then when CMS became kind of transitioned to CMS at 2001, that really became much more of an oversight and regulatory organization that looked much deeper at the costs associated, the systems itself, everything from how organizations function within that market and within that system to the costs again associated with those organizations and the system itself. CalMedi Connect, and I want to say this again in all fairness to those who created CalMedi Connect. CalMedi Connect is a partnership between the state Medi-Cal programs and the federal Medicare program. Obviously, Medicare has been in place and Medi-Cal, in fact, since 1965. So there has been ample time for those organizations to improve and become better at what they do and truly take on the responsibility not only for delivering care, but actually controlling the cost. There was a point where Medi-Cal, it was mandatory for those with Medi-Cal to have a Medi-Cal managed care program. Now that's transitioning more so to Medicare and Medi-Cal at this point. The Medicare portion is still optional. So even within CalMedi Connect, someone has to choose a Medi-Cal managed care program, but the Medicare portion, they can still opt out. My opinion is, and this is again just my opinion in all fairness to those who put the programs together, there's absolutely reasons why it makes sense for everyone to be in a Medicare managed care environment also, and it's not necessarily just for the controlling of the cost. There's some systems in place that actually create a healthier patient that I think is something that the system has become, where if you were to ask me that same question 10 or 15 years ago, they absolutely had their challenges in the delivery of care. So at that point, it was questionable whether it was the right thing or not. I think you mentioned Maverick, for example.
Yes.
A medical group of that caliber who delivers care in the way that they do, their focus is on the quality of care being delivered.
Yes.
The reality of that is if you create a healthier patient, the cost savings is just a byproduct of creating that healthier patient. So that today is the goal of the system. For the most part, again, many medical groups, some work better than others, obviously, as when we look at Maverick, again, that's one of the medical groups specifically in this area that I think has figured out that quality of care delivery system where the patients within that system, I think we're going to see higher outcomes when it comes to the condition of the patient, and again, producing less in the way of expenses.
Expensive. As we speak today, people have a choice of either going into a managed care to put their Medicare into a managed care system, or they can opt out. And the difference between I understand because I work very closely with the health plans and the benefits they offer, and everything else that comes with it. But sometimes it's hard to tell people and for them to, because they think that if the Medicare is fee for service, they can see any physician, but they have to compare the apples to apples and see what's in there for them. So can we just talk about the difference between if you opt out,
sure,
and then if you will be in a medical group?
Sure. Right now, the process that individuals are going through in order to just gain information about the CalMedi Connect program, they're at this point receiving a large blue envelope. And that large blue envelope has a lot of data and documents for them to read. If they don't respond to that document or to the documents within that blue envelope, they will be what's called passively enrolled into the CalMedi Connect program, which means they'll be enrolled into that program actually without giving their consent. The documents actually state if you fail to respond to these documents, you will be passively enrolled. With that said, many physicians, in fact, are suggesting that patients opt out of CalMedi Connect. I'm again I somewhat agree with the physicians that this is a pilot project. It's a 3-year test program, and many of the patients, as well as their physicians, don't feel that they want to be part of that experiment, so to speak. Managed care truly does work, and it works very well, but this is a new product, so to speak, that's being offered by the state that it's a test, and they'll determine 3 years from now, was it successful or wasn't it successful. Managed care in general has proven itself, and there's quite a few managed care products on the market that are referred to as Medicare Advantage prescription drug plans or MAPD plans. Those types of products, again, have proven themselves, and the medical groups are comfortable working with them. It's a safe parking place today for those who still want managed care, but don't necessarily want to receive their managed care through the CalMedi Connect program. So again, I still recommend that seniors or Medicare, Medi-Cal recipients join a managed care plan. I don't want to necessarily give my opinion that the CalMedi Connect product is today the right place for them to do that. I'm not saying, again, whether it is or isn't. I'm saying that the individual patient needs to do some homework, needs to sit down with someone, evaluate their interest and their conditions, and determine if that is the right environment for them. It will work well for some, but not work well for all. With that said, when we look at the enrollment data, about the last data that I saw stated about 39,000 had opted in to CalMedi Connect, and about 38,000 have opted out. So about 50% of those that had the opportunity to take part in CalMedi Connect have decided not to take part in CalMedi Connect. My concern is within the 39,000 that are actually passively enrolled or enrolled in CalMedi Connect, how many of those were the part of that population that just didn't respond to that blue envelope? Because most people feel, if I want something to change, I'll fill out a document and I'll send it in, then something will change. In this case, it's just the opposite of that. If they do nothing, then something will change right?
for them.
So they need to read through that document and try to determine what is the right thing for them, and then to sit down with a qualified individual. When you mentioned Word and Brown earlier, again, we feel that we are subject matter experts in this matter, and we feel that we are qualified individuals for someone to sit down with and say, this is my story, I'm a senior, this is what I'm going through, tell me what CalMedi Connect offers, and tell me what the traditional MAPD or Medicare Advantage programs offer, and then help me decide which environment may be the best for me. Many people will ask their physicians that question, and the documents that they receive actually ask them to talk to a family member, talk to those at a senior center, or talk to a physician. In my mind, none of those suggestions make any sense at all. Their family, obviously, I've been in this business for 22 years. I've truly studied the CalMedi Connect products and the system. It is confusing. And I've been in this business for 22 years. For an individual to ask a family member or somebody at their senior center or even their physician, they should go to their physician for medical advice. Their physician should not be advising them on which direction to go when it comes to a health insurance product. And that's not my opinion, that's Medicare's opinion. Medicare states clearly in their regulations that their physician may not be fully aware of all of the health plan benefits and may be seen as an agent of the insurance company and not acting as their physician. There are some financial advantages to a physician by going one direction or another, but the patient should not take those decisions into account when they're making their personal decision for the healthcare. Most medical groups work very, very well today. Most health plans work very, very well today. It's very different than it was 10 or 15 years ago. So opting out of managed care today, I don't believe is the wisest thing to do. Is CalMedi Connect the right thing for you? Maybe not. Is the Medicare Advantage program the right thing for you? Maybe, maybe not. Should some opt out? Some should probably opt out. But again, not knowing the individual story and what their circumstances are, it's difficult for us to recommend what would be right without completely having that full story. But once again, the physician, my opinion, is not the right place to go to ask, what should I do with my Medicare card, or what insurance product should I be joining?
But as far as you explained really well, oh my God, it really makes so much sense. But for example, I have a parent, my mom and dad. My father received an envelope. My sister called me, and she was, and my sister reads everything. Actually, she reads everything line by line, and she wanted to talk to me because I'm in the field. But I told her, I said, just hold on. I have a guest. I'm going to talk to my good friend Ken, and he will give us an advice. Maybe I can have you talk to my mom and dad. Because I want the best care for my mom and dad. Even though I'm in the healthcare, I know every physician, I know every hospital, I know every managed care system, but it's not enough. I need someone to sit down with my mom and dad and explain to them what's best for them. But as far as my understanding, just talking, just getting into this, the healthcare and the benefits, and especially the peak season is coming up, October through November, the open enrollment season. Just talking about that, and talking about the open enrollment and knowing more about that, and talking to different agents, they give you more benefits. You have more benefits. You have that's being more offered to you as far as the benefits, as far as medications, and you get more. So if you're going to be choosing between, should I opt out? If you opt out, you won't be having those benefits.
Right, that's correct.
So that's one thing that people need to understand. Yes, you can opt out and you can have a Medi-Cal that is not connected to any medical group, but you're giving up of all the benefits that's being offered to you when you're in a managed care system. Right. And coming back to Maverick Medical Group, the reason I promote Maverick with all my heart, and I really believe in Maverick, is because, as before, we were having a cup of tea, and when we talked about that, I said I really trust the people that are behind it, and because they're doctors. One of them is our dear Dr. Warren Hosseinian, who is a physician and who truly understands what the needs are for the patients. That's why they have made this system of the specialists and the primaries and the hospitals. And just everything just falls in place. And I myself, coming from working with different medical groups, I see that these are people that care, and that's the reason, because I'm someone that I have to truly believe in what people are offering, what people are telling you, because today we have so many information out there, so different medical groups telling different stories, but this is one group that I truly believe in, and I truly tell my viewers, tell everyone, I even will sign my mom and dad to Maverick Medical Group because I truly believe in them. So as coming back to medications, the plan Part D. Part D is part of the medications. Now, if you opt out, will you have the same benefits? Because medications today is very important, because people have different sicknesses and they have medications that's being covered. If you opt out, will you have the same benefits? And if you were in a medical group, let's say if you're getting this one expensive medication and you have very serious condition, will it be the same or will it be different?
Well, all health plans, first off, let me back up and say that if you opt out, you still have to have, or still are required to have, a Medicare Part B prescription drug plan.
Okay.
Each of those drug plans may have a different formulary. The formulary is basically a list of medications saying that these are the medications covered by this plan. The same would apply to a Medicare Advantage program. They all have a formulary, a list of medications saying that these are the medications that apply to this health plan, for example. The confusion comes in when a patient has a bottle sitting on their table with a certain name on it, and they say, is my medication covered by this plan? That answer may be yes or no. The reality is each health plan or each formulary, regardless of the plan, has to have multiple medications on that formulary to cover that same condition that you're being treated for. So if the exact name of my medication is not on that formulary, good chance that there may be a medication on that formulary that covers that exact same condition in the exact same way. In some cases, they may have to go through what they call step therapy, meaning that they need to try the various different medications on that list to see if they can find one that works as well, if they don't get it correct on the first go around. And then also all of these health programs have an exceptions process that either the patient or the physician can say that based on the medical history of this patient, we've tried these various different medications, and the only one that seems to work is this medication that's not on your formulary. So we're going to request an exception, meaning that we want to go ahead and get that specific medication approved for that patient on an ongoing basis. So within all of these programs, there are grievance and appeals processes, there's exception processes, there is a lot of built-in safety mechanisms that are truly there for the benefit of the patient. There was a time again where people felt that most of these programs were just in place to save money for the system. And it's true that throughout the years, it's always been questioned, how long will Medicare be able to exist under our current status or current arrangement? These programs, again, are designed today to truly look at the health of the patient. There's incentives in place that are in place for physicians and medical groups to improve the quality of care. And with that said, I really truly believe that when you look at managed care, and the way that I liken it is, for example, if you've ever worked for a company of any type or known of anyone who's worked for a large company, if that company was unmanaged, there were no managers, no supervisors, can you imagine the chaos and confusion within that company? A managed care environment is having a physician or a team of physicians in place to eliminate that chaos. When we're thinking about our health care, that's extremely complicated. So to have someone in place or a team of individuals in place that I can go to that help me through those different chaotic conditions, I think is extremely valuable.
Wow. Okay, one question that I want to give you. Why should you consider, as an expert, Ken, you are an expert in Medicare, and the information you're giving us, and I think this is not going to be the last time I need to invite you again because, you know, our time is like just flying away. Why should people consider managed care plans, or why should they go into a managed care system? Let's say if I was asking you this question and I wanted to make a decision for my parents, what would you tell me?
I'll tell you that, again, I've been in this business for 22 years. I have the ability to choose or purchase a variety of different types of health insurance, and I truly understand those various types of health insurance. I myself am in a managed care plan because if I get ill, I want to be able to go to a physician, ask that physician what I should do next, and know that within that system that there's open communication between my primary care doctor, my specialist, those who are providing tests, and there's a cohesiveness within the system that allows that level of communication, so all of my team that are taking care of me is aware of what one another is doing. In a non-managed environment, you don't have those connections. You may, in fact, 17.5% of all emergency room admissions are due to drug interactions.
Yes. 2
different doctors give you 2 medications. Exactly. Those doctors are not communicating. There's a drug interaction. So almost 20% of everyone who shows up to an emergency room is there due to a drug interaction. That's a good example.
My background, because I work in a hospital, I remember when we used to have people coming to the ER because they've been seeing so many physicians, and then when they up in the ER needs to call a physician that's been following this patient, and there is no physician because there's so many. Right. And people are confused, and if you ask them who is your primary care physician, they're like, oh, I don't know. They would just give you so different names. But what happens is, like you said, there's always a problem that can cause because somebody has to give them a history to the ER, so the ER knows, emergency room doctors, correct, they know what needs to be done and what's the condition and the medications, which is very important. So managed care system will be a system that will give quality care, and that's what we want today. Right.
It delivers, it improves the quality of care, and it reduces the mistakes and the errors within the system due to, again, the communications involved. And when we look, again, you mentioned Maverick, and I'll do the same. Maverick, I believe, again, is one of those organizations that truly recognizes that and has those systems and those communication methods in place where if a patient is part of that medical group, and when you join a managed care plan, you'll need to choose a medical group for those in this area. I would highly recommend that they consider Maverick when making that choice. Just again, due to I always say that an organization is only as good as the people that are within that organization. The quality of individuals that I see at Maverick working with that organization and engaging in those philosophies of quality care has been very impressive to me. So, and I've been around many medical groups over my years, and I've helped develop some medical groups. I'm very happy to be working with Maverick.
I think I second that. I validate what you said because I myself work with many different medical groups, and today one group that I truly believe in, and I want to continue working with them and promote them and just put a good word out there is Maverick Medical Group. Because like I said, Dr. Hosseinian is someone that you can talk to him whenever you need to. He's available, he's accessible, and he cares because he's a physician. And the bottom line is today we want healthier patients. We want patients to be healthy. And what everybody wants today to be healthy. And for you to be healthy, if you're in this managed care system, there are good quality people. They will control and they will manage you in a way that you will be healthier. So there is this miscommunication that, like I said, there is so much information out there, and with our TV programs, with the Armenian TV programs, we have people that they're trying to talk about this Medicare and changes, and sometimes, you know, my hats off to everyone, but some people, you know, they pretend they're experts, but in my opinion, they're not, because they're giving out wrong information. That's the reason, Ken, I wanted you to come to our show, and thank you so much for your time, for being here today. You really gave us very good information. I just have to, my next show, I have to do this in Armenian so I can tell my viewers what exactly you said, but those of you who do speak English, and I'm hopefully, you know, you can translate this to your moms and dads, like I would do the same for my mom and dad. Սիրելի բարեկամներ, ինչպես որ տեսակ, մեր այսօրվա մեր հյուրը շատ կարևոր մի հյուր էր, Mr. Ken Rasmusը, որը ներկայացնում է Ward and Brown organization-ը, եւ այսօր նա մեզ տվեց շատ կարևոր information, եւ ես ինչպես որ նշեցի, նա այսօր Medicare-ի expert է, որը հասկանում է Medicare-ի փոփոխությունների մասին, եւ information-ը ինչ որ այսօր Ken-ը փոխանցեց, շատ կարևոր information էր, եւ մենք շատ կուզեինք, որ դուք այս information-ը փոխանցեիք ձեր բարեկամների հետ, եւ այս շոուն հիմա որ դուք նայում եք, կկրկնվի նաեւ Կիրակի առավոտյան, եւ ես կխնդրեի, որ եթե դուք ունեք երեխաներ, որ խոսում են անգլերեն, եւ ծանոթներ, որ անգլերեն հասկանում են, խնդրում ենք, որ նրանց ասեք, որ Կիրակի առավոտյան այս շոուն պետք է կրկնվի եւ նրանք նայեն եւ այս information-ը փոխանցվի նրանց, որովհետեւ ինչպես որ մենք գիտենք այսօր, բոլորս էլ շփոթման մեջ ենք այս փոփոխությունների հետ կապված, որովհետեւ դրսում կան բավականին շատ սխալ ինֆորմացիաներ եւ մարդիկ կա, որով դեռ հավատում են, որ փոփոխությունները տեղի չեն ունենում։ Սիրելի հայրենակիցներ, ես հավատացնում եմ, որ այս փոփոխությունները տեղի են լինում եւ շատ ճիշտ կլիներ, որ դուք ավելի տեղեկացվեիք եւ մեր նպատակը այսօր Hospice of Gracie դա է, որ դուք տեղեկացվեք եւ անեք ճիշտ որոշումներ ձեր առողջության հետ կապված։ Ken, thank you so much. Again, I would definitely want you to be my guest again because there is so much we didn't cover. Hopefully I can have you again. Thank you so much for your time and good luck to you.
Thank you.
Սիրելի բարեկամներ, շնորհակալություն ձեր ուշադրության համար։ Մենք նորից կհրավիրենք Քենին, որ նա լինի մեր հյուրը։ Իսկ հիմա ձեզ հրաժեշտ եմ ես տալիս եւ խնդրում եմ, որ մեզ նորից փնտրեք նորալիքի եթերում։ Շնորհակալություն։